Today, we're going to decode a really critical message from your heart, angina. And it's so much more than just chest pain. Think of it like an alarm bell, a clear signal that something is seriously out of balance inside. So you got to ask, why does the heart, this muscle that just works and works 24/7, suddenly send out a pain signal? Well, it's not random. It's actually a very precise alert, telling us that the balance between what it needs to function and what it's actually getting is dangerously off. So here's our game plan. We're going to start with that core problem, the heart's supply and demand. Then we'll look at the three different faces of angina. From there, we'll get into the mission of treatment, opening up the pharmacological toolkit doctors use to fix things. We'll even check out some smart drug combinations and then wrap it all up with a simple analogy that'll make it all click. Okay, let's get right to the heart of it, no pun intended. Everything, and I mean everything, about angina boils down to this one fundamental idea, the balance between supply and demand. If you get this, you get angina.
The official name is Angina Pectoris, but here's the most important takeaway on this slide. Angina isn't the disease itself, it's the symptom. It's the smoke detector going off, not the fire. The fire is the underlying heart disease.
Let's break that down. It's a simple two-sided equation. On one side, you have oxygen supply. This is the fuel, the oxygen-rich blood being delivered through the coronary arteries. Think of them as the fuel lines to an engine. On the other side, you've got oxygen demand. That's how hard the engine is working. When you run or get stressed out, that demand skyrockets. Angina is what happens when that fuel line just can't keep up with the demand.
But here's where it gets interesting. Not all angina is the same. The kind of pain, when it happens, and what triggers it can tell us a whole lot about what's really going on and how dangerous it is. Let's meet the three main types.
First up, we've got stable angina. The name says it all. It's predictable. It shows up when you exert yourself and it goes away when you rest. It's usually caused by a fixed narrowing in an artery. Now, things get much more serious with unstable angina. This is the scary one. It can happen even when you're just sitting there because it's caused by a piece of plaque breaking off and forming a clot. This is a true medical emergency. And finally, there's a really unique one called Prinzmetal angina. This one's caused by a sudden, intense spasm in a coronary artery that just clamps down on blood flow.
So if the whole problem is an imbalance, the mission is crystal clear, right? We have to restore that balance. The question is, how do we actually do that? Well, there are two main ways to attack the problem.
We can come at this from two angles. The first strategy is to boost the oxygen supply. We can do that by widening the blood vessels, forcing a spasm to relax, or even using drugs to bust up a clot that's blocking the pipe. The second strategy is to go after the other side of the equation. Let's decrease the heart's demand for oxygen. We can do that by slowing the heart down or by reducing the pressure it has to pump against, basically telling the heart, hey, just take it easy for a bit. Now, to pull all this off, doctors have an amazing toolkit of medications. Each type of drug is like a specialized tool, designed to help restore that crucial supply and demand balance in its own way. Let's open up the toolbox and see what's inside.
Our first tool is probably the most famous one, the one you've definitely seen in movies. That little pill someone puts under their tongue during a heart-pounding scene. We're talking about organic nitrates, and the classic example is, of course, nitroglycerin.
So how does this magic pill work? It's actually genius. It releases something called nitric oxide in the body, which is a super powerful muscle relaxant for your blood vessels. But here's the twist you might not expect. Its main effect is on the veins. By making the veins wider, blood kind of pools in your arms and legs, so less of it returns to the heart to be pumped. This drop in how much the heart has to handle, which we call preload, massively cuts down its workload. And as a nice little bonus, it also widens the coronary arteries a bit, boosting supply. All right, on to tool number 2. These drugs tackle the problem from the complete opposite direction. Beta blockers are all about reducing the heart's demand for oxygen. Beta blockers are basically like putting a governor on an engine. They block these key receptors in the heart muscle, and the result is the heart beats slower and with less force. Both of those things directly lower how much oxygen the heart needs, which is perfect for preventing that exertion-based angina. But, and this is a big but, you should never use them for Prinzmetal angina because they can actually make those artery spasms worse. Our third major tool in the kit is the calcium channel blocker, or CCB. These are the versatile multitaskers of the group. They can really attack the problem from a couple of different angles. CCBs work by blocking calcium from getting into the muscle cells of your heart and arteries. And since calcium is what makes muscles contract, less calcium means more relaxation.
This chills out the arteries all over your body, which lowers your blood pressure and makes it way easier for the heart to push blood out. We call that reducing afterload. And because they are so good at relaxing arteries and stopping spasms, they're the absolute #1 choice for treating that Prinzmetal or variant angina.
So we have these really powerful individual tools, but the real magic in treatment often comes from using them together. Let's look at how some smart combinations can work synergistically to get an even better result. You know, some of these combinations are just brilliant. For instance, if you pair a nitrate with a beta blocker, the nitrate lowers the heart's workload, but sometimes your body overreacts and speeds up your heart rate. Well, the beta blocker is right there to put the brakes on that reflex, which is perfect. It's the same idea with some powerful CCBs. They can also cause that reflex fast heart rate. And again, adding a beta blocker just cancels out that side effect. It's really smart medicine. Okay, I need everyone to listen very, very carefully right now. This is an absolutely critical safety warning. There is one drug combination that is a huge no-go. You can never combine nitrates with PDE5 inhibitors. That's the class of drugs that includes sildenafil. Both of them are powerful drugs that widen blood vessels, and if you take them together, they can cause a sudden, catastrophic, and potentially deadly drop in blood pressure. This is not a suggestion, it's a life or death rule.
All right, I know that was a lot of pharmacology to digest. So to help tie it all together and make it stick, let's use a simple analogy. Think of managing angina like managing a furnace in your house.
So your heart is the furnace, working hard to heat the house. Angina is that straining sound the furnace makes when it can't keep up. Nitrates, they're like walking over and just opening a few windows. By letting some of the heat, or in this case the blood volume, out of the system before it even gets back to the furnace, you're reducing the demand. That's a perfect way to picture how they decrease preload.
Now, beta blockers are much more direct. They're like walking right up to the thermostat on the wall and just turning it down a few degrees. You are actively, directly telling the furnace to work less, to generate less heat, which in the heart's case means beating slower and with less force. You're lowering the energy demand at the source.
And finally, our calcium channel blockers. Think of these as making the furnace's job easier on the way out. They're like widening all the pipes and ducts leading away from the furnace. By relaxing all those pathways, they lower the pressure the furnace has to pump against. It makes the whole job much, much easier. And that's a great way to think about reducing afterload. So, when you step back, it's clear we have an incredible toolkit to manage the supply and demand crisis, to silence the alarm bell of angina. But that leads to the big question, doesn't it? With all these sophisticated tools to manage the symptoms, what's the next great frontier in actually putting out the fire, in treating the root cause of the heart disease itself?